Kelly, I think I'm going to go ahead and get started here just so we can get rolling. But do you want to take care of the, what is it called? Waiting room?
Yeah, you bet.
Okay, that sounds good. Well, hello, everybody, and happy Thursday. My name is Rachel Schramm, and I work at the Iowa Cancer Consortium, and I work as a senior outreach specialist, and I'm kind of steering the IFP process this year. So every year we do a webinar just to kind of get our partners together and to really just share what's in our application, kind of what you need to do, and answer any questions that you guys have. So I think we have enough people on that we won't be able to do verbal introductions, but if you wouldn't mind using the chat and just putting your name and what organization you work for. And then if you're interested in partners, maybe put, you know, what kind of grant you guys are thinking about applying for or a specific topic area, and that might help people find one another. So yes, today we are just going to go through our application process, our funding priorities, and yes, hopefully you'll get some inspiration. I was going to say we're going to keep this pretty informal, so if you do have questions, feel free to pop them in the chat or unmute yourself and we'll go ahead and answer those. The other thing I'll mention is we'll just stop at the end as well, just to answer any questions that you have. Okay. Well, just a little bit about our organization. So as you all know, cancer is a crazy complex disease and fixing it is so hard to do alone. We need people from a variety of disciplines, a variety of geographic areas to really work together in order to reduce the burden of cancer. And that's really why there's coalitions like ours, like the Iowa Cancer Consortium, that exists within other states as well, to gather input from stakeholders and really try to bring people together on a common platform to work on a common issue. So we have the good fortune in Iowa that we have funds from our state and federal partners that we're able to grant them out to community projects across the state to work on those cancer prevention and control efforts. So that's really what our process is all about. I think a lot of you are really familiar with the Iowa Cancer Plan, which outlines basically just big goals and strategies for reducing the burden of cancer in Iowa, starting from everything like cancer prevention and screening through treatment, quality of life, and everything related to health equity. So we truly believe that if you want to do something to reduce the burden of cancer, that you can find it and link it to our cancer plan. So thank you for being here and for your interest, especially during a pandemic time. We're happy that so many people have an interest. So just quickly, I wanted to run over what some of our priority areas are for our FY22 invitation for proposals. So really, these are our 3 aims. You don't have to tick all the boxes, but the more you have, the better, we think. So, and these haven't changed a lot since last year. So the first priority area is providing support for communities who bear the burden of both cancer and COVID-19 or the coronavirus. We realize that those two, you know, when linked together or when they intersect, that there's specific issues or burdens that arise, and we want to make sure that we're meeting those needs. The second is identifying creative adjustments to cancer control practices for kind of this like mid to post-COVID, what we hope, landscape. So how are we getting people in for you know, different cancer screenings or their treatments or their immunizations? We really want people to kind of think outside the box as for how they're going to get people in safely to take care of them. Number 3, and super important that we've had throughout this process, is addressing issues of systemic racism and inequities across the cancer continuum. We think this is so important. And I will touch on this later, but in the past, we've had a lot of applicants that kind of say like, well, you know, our programs don't discriminate, they're open to everyone. And we really want to get away from just that like kind of blanket statement. We really want people to kind of peek under the hood and really see like what policy changes could be made. You know, how could I offer this program differently so that it's way easier for people to access it that might have other burdens that maybe your programs haven't thought about before. And just for anybody who's not familiar, I can put a link to the cancer plan in the chat here in a bit, but this is our plan. We have it available online, and this is kind of our 4-year plan that we worked with partners to create. That's really a blueprint for cancer control efforts. And like I said, I don't know, I kind of feel like if it's not in the cancer plan, like maybe you don't need it. We really tried to put everything we can in there. So definitely contact us if you don't see how your project fits into this. But we really think you'll find a link for your project within the cancer plan. So check that out if you have time. Next, I was just going to share a bit about our timeline. And this is Kelly's dog, Annie, looking at the cancer plan because it's, so good, even dogs love it. We have our applicant webinar today, and then on April 1st, April Fool's Day, we are asking for very simple letters of intent. So that could be submitted through just a really simple, text in an email, or if you want to attach like a Word document or PDF to be fancy, you can do that too. And this just has to be really simple, just letting us know who you are and kind of your intent to apply, and maybe just some sort of inkling of like what your project might be about. So for example, my name is Rachel, I work at the Consortium, and I'm planning to submit a project about, sunscreen at parks or something. And this is really helpful for just our staff to, one, just know that you're planning on applying, two, to just know kind of what topic area you're applying for, to see if maybe there's other partners we might be able to connect you to, or just to kind of have an idea of what topics are really hot right now. And then third is just so that we can plan on how many reviewers we're going to have. We do have reviewers that are familiar with cancer control that review our grants from outside of the state. So we really like to just have a good idea that we'll have enough reviewers for the project. The applications are going to be due on May 6th, and we made it so that they're due at 11:59 p.m. So you will have time, but we hope that the application is streamlined enough that you won't need to push it until then. So those are due on May 6th. And again, those are just electronically. We don't have, like, through email. We don't have an online, like a forum on our website or something like that. Other than that, we will have our outside reviewers take a peek at the application, score based on the rubric that we've provided on our website. And then we hope by the end of June that we'll be able to have our board meet, and they are the alternate ones that make the decisions on what projects will be funded based upon how much money we have from the state. But we hope that the award notification will happen towards the latter half of June, and then the project period would officially start July 1st of this year and run until the end of May next year. Just a couple of notes about our budget. Kind of the big high points is that you're able to apply for up to $25,000 per year. And we do leave it open that if you have a project that you want to span 3 years, you are able to apply for up to 3 years of funding. So you're not necessarily, granted that funding for the 3 years right away. You have to reapply kind of every year, but it's kind of coming in with the idea of like, this is my baseline year and I'm going to build upon it. And this is kind of forecasting out what I want to do. There's no minimum to apply, I guess I would say. We have some organizations that are a little bit scared by the $25,000 number. So you don't have to apply for that huge amount. You could apply for $4,000 or something if you wanted, just whatever meets the needs of your projects. Kind of related, if you're a small community organization that maybe doesn't have the staff to closely monitor your spending or your budget, the consortium is also able to serve as a fiscal agent for organizations. So don't let that be a barrier to applying as part of this process. The grants must serve Iowans and have to be related to something in the cancer plan. We have had a couple of questions from people kind of on the shores of Iowa, the borders of Iowa, that say, I have partners in Illinois, Wisconsin, Nebraska that I want to work with, am I still eligible to apply? And we think yes, but you will definitely need to talk about in your budget like how you're serving Iowans, and just kind of give out some projections of how you seek to do that and how many Iowans you'll impact. And it's very important to us that we have tobacco-free events. So I don't think that really needs an explanation. But what we don't fund, we do have this in the some of the grant documents if you want to take a peek at those as well, but they can't be used to replace dollars that are currently earmarked for cancer programs or projects. Funds cannot be used for lobbying. They cannot be used to cover indirect costs that might include like administrative or overhead costs. And we typically do not fund projects related to clinical care, like the provision of medication, vaccination, or treatment. However, service delivery like cancer screening or radon mitigation purchases will be heavily reviewed. We've funded some like that before. Let's see. The other thing I will mention, we do our best to fund evidence-based projects, and at least in the vein of cancer screening, incentives a lot of times have been proven to increase uptake of those. So incentives are an allowable expense if they're proven to be effective as an evidence-based intervention. So you'll have to include that in the application, and we'll review those and work with you as well. Let's see. Again, on our website, we tried to make it easy for folks. So we do have a couple of sample items that you can check out. We have a sample budget worksheet that contains all the rules for what we will and will not fund. We have a sample letter of intent. And again, I just want to reiterate that it can be super easy, but it just has to tell us who you are, just in general, what it's about. And really what we take from it is that you're going to apply, and we need to, figure out those numbers of how many people we have and how many reviewers we're going to need. We do have a blog post on our website about evidence-based resources and program planning. So if you want to check that out, that's great. Again, our staff can help you with that as well. We do have a link for our funded projects from last year if you want to take a peek at what types of projects were funded. And then I did just want to share, hot off the press, I don't know if it's been 2 weeks, Kelly, that the 2021 Cancer in Iowa report is out. So this is from the State Health Registry, the Cancer Registry of Iowa. They put out a report kind of projecting what the burden of cancer is going to be for the next year, and they always pick a specific cancer topic to focus on. So traditionally it has been focused on a specific cancer like ovarian cancer, lung cancer, and they kind of do like a deep dive into what we know about those cancers in Iowans. And this year, it's actually uniquely focused on disparities in cancer. So if you haven't had a chance, we would encourage you to check that out and use some of the stats. Use the Cancer Registry website in your grant application. I think it's great for you to understand what the burden is in your county or region, and it also, the grant reviewers and board really like to see that as well. I did want to mention that technical assistance for the application is provided by the consortium staff. We highly encourage any grant applicants to connect with a member of our staff to discuss, or we can review applications as well. However, making contact is not required, and proposals won't be helped or hurt by working with us in the scoring process. We just want to be there for you. We know that everybody, some people are very seasoned at writing grants, and some people, this is only the first grant that they've ever written. So we want to be there. We want to be supportive for you. So I did list our staff. Our executive director, Kelly Wells-Sittig, is on the Zoom today. Kelly Rollins is our administrative and finance coordinator and can answer a lot of questions related to budget expenses or financing. myself, and then my colleague Sloan Henry, who's a community health educator. We would all be happy to talk with you about your application. As I mentioned before, when the grants are due on May 6th, we'll take all the applications, kind of scrub them to make sure that they are all correct, that the budgets all add up, and then we send them out across the nation to be reviewed by our reviewers. And then when they come back in June with the official scores from the rubric, our board of directors are the ones who make the actual funding decisions. So taking into account what the average scores are for the applications and also like what the need here is in Iowa, but our staff are not involved in the decision making at all. I was gonna say, that kind of concludes the slides. Kelly, do you feel like anything's missing or anything that you want to share with the group? No, okay.
No, that's great, thank you.
Awesome. And I'm gonna look in the chat here to see if anybody has any questions at all. We have this recording, so I'm gonna edit it quick and then I'll put it up on our website and send it out through our email list. So this will be available again. But we do have the PDF application on our website, but we also have a PDF of just the instructions, and that's basically everything that I went through today. So Wendy is asking, just to confirm, our organization is located in Illinois, but we'll be using this grant funding exclusively for cancer patients in Iowa. Are we eligible to apply?
So I can take that one, Rachel.
Thank you.
Wendy, thank you. That's a great question. And the answer should be yes, as long as your budget also reflects that all of the funds will be used to support cancer patients in Iowa. So it might be, well, it's always worth chatting with a member of our staff, but I think maybe in this case, it would be especially worth working with our staff to make sure that your budget before application reflects that in a way that will fit with the board's funding priorities.
All right, and let's see, Christy, I know I owe you a call to confirm we can work with partners from outside of Iowa for our project. Absolutely. Absolutely, you can work with partners from outside the state, but again, it'll just be really important that you document like how you're serving Iowans and how many you'll serve. You'll just have to make that case a little stronger. All right, thanks. All right, any other questions that people want to type into the chat or want to come off mute, come on video when you're done with your lunch? Okay, well, yes, so the simple, James, can funds be used for subject compensation? It's a good question, James.
So I think that would fall into the incentive category, if I'm understanding your question right, James. And so I think the board has been hesitant about that in the past, but if there's a good evidence base around the intervention that you're doing and what you're recommending the compensation for, then they will be more likely to support that. So I don't want to steer you away from it, because I think the key will be the evidence, being able to show the evidence base for the incentive or compensation. Let me know if that didn't answer your question.
Awesome. And I just dropped my email into the chat as well. All right, James says that's clear, thank you. Okay, well, I was gonna say, I think Kelly and I are just gonna stay on for a couple minutes after we end this webinar. So if anybody does wanna stay on and chat through something, we're happy to do that. Otherwise, I would just say, yeah, submit a letter of intent. Again, the simple one before April 1st. You could submit it to me today if you want. That doesn't lock you into applying, just helps us give us a good idea of what to expect. And then, yeah, applications are going to be due on May 6th, but we're here for you. So reach out if you have any questions at all. So again, thanks so much for your time. Looking forward to your applications. Thank you. Bye.